Hi ma'am, I'm Rochelle De Vera from BSN 2A Group 2. And today I'm going to demonstrate the administering oxygen via nasal cannula and simple oxygen mask. So we have the purposes. First is to deliver low to moderate levels of oxygen to relieve hypoxia. Second is to allow uninterrupted delivery of oxygen while our patient or client is ingesting food or fluid. So now, let's proceed for the preparation. So in preparation, we have the assessment. So we need first to assess our patient or client with their skin and mucous membrane color and also their breathing pattern and also the chest movement and chest wall configuration. Also, the lung sound that is audible by auscultating their chest. And also by ear. And if there is a presence of clinical signs of hypoxia, like anxiety, decreased level of consciousness, inability to concentrate, fatigue, also cardiac dysrhythmias, also pallor or cyanosis, and dyspnea. So those are the signs of hypoxia. So now, let's proceed for our planning. So in planning, we need to assemble and prepare all the equipments that we need. So we have here, actually we need the appropriate oxygen delivery system, which I have here the nasal cannula and also the simple mask oxygen, which includes with the oxygen concentration about 40 to 60%. Also, we have here the oxygen tank, and we have here the flow meter, and also the humidifier and distilled water for a high flow oxygen therapy. And also we have here the no smoking signs and also the tape, and tape is optional. So now, let's proceed to our implementation. So implementation, first thing to do is we need to review the physician's order for oxygen to ensure that it includes the method of delivery, flow rate, and also the titrations order. And also, in order for us to identify our client. And then, next thing to do is we need to perform hand hygiene. So we need to wash our hands. So now that we wash our hands, now we need to identify our client or patient and then proceed with the 5 rights of medication administration, which the right patient, right drugs, right route, right dose, and also the right time. And then you need to explain to the client the procedure that you are going to do. Explain that the oxygen is can ease dyspnea or discomfort, and you need also to inform the client or patient concerning with the safety precautions associated with the oxygen use. Also, you need to help or assist your patient or client in a semi or high Fowler's position if it is tolerated. So in administering oxygen via nasal cannula, we need to insert the flow meter to the wall outlet if it is available. But as I am using a oxygen tank, so I'm going to insert or put the flow meter to the oxygen tank. And then you can get the oxygen tubing and then put the oxygen tubing to the nozzle part of the flow meter, which is the nozzle part is at the which is located to the lower part of the flow meter. But you can also insert the oxygen tubing to the humidifier if you are going to use the high flow oxygen therapy. So we are going to put the oxygen tubing, and then you need to turn on the oxygen, and you need to put it in the prescribed rate or prescribed oxygen rate, so using the flow meter. And then make sure, or you need to ensure that the oxygen or the air in the oxygen is, the oxygen is flowing through the tubing or the oxygen tubing. So you need to make sure that there's an air, which is the oxygen. And then you need to put the you need to hold the nasal tubing in its proper, or yes, in its proper position, which the prongs curving downward like this. It should be like downward, and then put the prongs to the nearest. And then the oxygen tubing should be near or behind the ear. And actually there is a adjustment at the chin part, where you as the client or patient is comfortable with, so you can adjust that one. And you can also put a gauze at the ear beneath the tubing as necessary if the prongs in the nearest is dislodged, or if it is loose like that. And by administering oxygen via simple oxygen mask, we need to insert the flow meter to the wall outlet or by the oxygen tank, and then attach the oxygen tubing to the flow meter. And if you are going to use a high flow oxygen therapy, you need to attach the oxygen tubing to the humidifier. So we need to put the tubing to the humidifier, and then turn on the oxygen with its prescribed oxygen rate. And if you are going to use a what do you call this one, a preserver mask, be sure to allow the oxygen to fill the bag. So now we need to put the mask to the face of our client or patient. So by placing it from the nose to the chin, and then you can adjust the metal rim over the nose, and then contour it to the face of your client or patient. And for the evaluation, we need to assess for proper functioning of the equipment and to observe the client's or patient's initial response to the therapy. And also, we need to monitor continuous therapy by assessing for pressure areas on the skin of the patient or client, and nurse every 2 hours, and rechecking the flow rate every 4 hours to 8 hours. And also, we need to perform follow-up based on the findings that deviated from the expected or normal for the client or patient. And then we can also relate the findings to the previous data, in the previous data if it is available. And then also identified unexpected outcomes. And for the recording and reporting, we need to record and report all the pertinent information of the procedure that we did or that we perform. And we need also to record and record the pre-procedure and post-procedure vital signs of the client or patients. And also, we need to document all the evaluations of the patient or client or the caregiver learning.